Hi, welcome to the Skills for Africa Nurse Modernisation Programme, and this is the third module. We'll be covering skills and concepts to do with nursing assessment. Connected with this area are nursing models, and you should of course prepare by looking at the nursing process information that's in your DVD or online in the folders pre-course and the folders for modules 3 and 4. Okay, but of course do your own self-directed learning, do your research, look at Google, and of course most importantly of all, reflect for your practice. Okay, so nursing assessment. This is of course the foundation of nursing practice. The information that we gather should be comprehensive. We should analyse clients' needs in a holistic manner, meaning to say, of course, the total person, mind, body, soul, spirit. Nursing assessment includes both physical and psychosocial aspects to evaluate a client's condition before we plan care. Let's look at the basic components of the assessment, which is first of all the health history, and secondly the physical examination. The health history is a review of the client's functional health patterns, what was happening to them in terms of their health before they came to your attention or they were admitted to hospital. The components of this health history include demographics, the reason that they sought health care, the perception of their health status, what previous illnesses, hospitalizations and surgeries they had. If you're in the UK, of course, there should be comprehensive records of their health history, considering the client and the family medical history as well, what allergies, immunizations, current medications, any developmental issues, the psychosocial, the sociocultural history, activities of daily living, and review of systems. Now let's look at those in greater detail. Demographics includes name, date of birth, etc., their ethnic origin and occupation. The reason for seeking healthcare should be described in the client's own words. No assumptions on your part. What does the client think? The perception of their health status is the client's opinion, of course, of his or her general health. Developmental level, what knowledge do you have? It is essential for considering the appropriate norms of behaviour. Any recognised theory of growth and development can be applied for assessment purposes. The psychosocial history, looking at psychological and social aspects, include the psychological aspects of self-concept and self-esteem. How is the client feeling about themselves, their morale? Sources of stress for the client and how the client is coping. Sources of support for the clients in crisis, such as family, significant others, religion or support groups. Sociocultural history, what is their home environment, their family situation, and what is their role in the family. Now, the review of systems is a brief account from the client of any recent signs or symptoms associated with any of the body's symptoms. Relevant data regarding symptoms. We've got to consider the location, the area of the body in which the symptom or pain is felt, character, the quality of that feeling, what it is like, sharp, dull, stabbing, etc. The intensity, the severity or quantity of the feeling, and how it interferes with their functioning. Timing, and the aggravating or alleviating factors, activities or actions that make the symptoms worse. Right, now to the physical examination. And there are specific policies which may vary from health authority to health authority, hospital to hospital, in terms of the nurse's role, the extent to which he or she conducts detailed physical examination. So let's look at aspects of this. The examination is head to toe, of course, using some specific assessment techniques, including visuals, inspection, touching, palpation, percussion, and auscultation. Now the positions vary for physical examination: sitting, supine, Sims, knee chest, dorsal recumbent, prone, and lithotomy. And again, the nurse's role in conducting this will vary both on health policy, which may vary locally, and also it of course will depend on the nurse's specialized skills and qualifications. Right, the introduction of the nurse is at the beginning of the physical assessment, and this enhances the ability to accomplish the whole assessment. Special considerations, of course, should be made considering the needs of the elderly, disabled clients, and those who may have been abused. Vital signs, of course, TPR and blood pressure. Now, let's look at the terms pertaining to pulse. Pulse rates, which you're familiar with, pulse rhythm. Less familiar is pulse amplitude and pulse deficit. Read this and become well acquainted. Terms pertaining to respiration: apnea, easy respirations; hypo, ventilations, that's shallow, and deep, which is hyperventilation. And lastly, dyspnea, difficulty in breathing. BP, we look at the favoured site as the brachial artery. Alternative is the popliteal artery behind the knee. Pulse pressure is the difference between the systolic and the diastolic BPs. Height and weight measurements are important, of course, a part of the assessment and the nurse recording system. Neurological assessment, of course, focuses on level of consciousness, pupil response, hand grasps, foot pushes. You should be well acquainted with the Glasgow system. Assessing effect. Mood. When describing a client's effect, the nurse must utilize terms that are descriptive of the specific behaviour, not the nurse's judgment about the behaviour. Okay? Based upon careful questioning and observing the client to see how they're feeling, what they're thinking about. Chest assessment. Thoracic focuses on cardiovascular status, the respiratory status, if there are any wounds, scars, drains, tubes, dressings, and the breasts. Types of normal breathe sounds: bronchial, loud and high-pitched with a hollow quality; bronchovesicular, medium-pitched and blowing; and vesicular, soft, breezy. Terms pertaining to breath sounds: the adventitious breath sounds, which are abnormal, of course; sibilant wheezes, high-pitched whistling; sonorous wheezes, low-pitched snoring; crackles, popping sounds; pleural friction rub, low-pitched grating sound heard on inhalation; and stridor, high-pitched harsh sound heard on inspiration, while trachea or larynx is obstructed. Abdominal assessment focuses on gastrointestinal and genitourinary status. Includes use of inspection, auscultation, percussion and palpation within the 4 quadrants of the abdomen to establish bowel function and status. The musculoskeletal and extremity assessment through observation of clients' gaits, how they're standing, walking, and overall range of movement. The nurse is able to obtain some knowledge of the symmetry and strength of muscles. Assessment of wounds, drains, tubes and dressings. Of course, you must maintain accurate documentation of drainage, colour and any other changes. Well, that concludes this brief overview of assessment, and there's some more work to do. This will lead us into the next module on nursing process, and you should do much research and preparation. Go to the Read Books folder on your DVD or online and pick out the following two books: The Evidence-Based Practice in Nursing and Healthcare and the Delmark Fundamentals of Nursing. Read everything to do with assessment and the nursing process and get ready for an assignment. Of course, as usual, use reflective practice. Thank you. See you soon.